with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Welcome back to another episode of Coffee with Coker. If this is your first time listening, my name is Mark Reiboldt, and I am the host of the podcast, and I am a senior vice president here at Coker. For this episode, it's just going to be me, and I'm going to cover a topic that is actually a series that we wrote about here towards the end of 2020, or it's been gradually released in 3 parts. So we'll make sure those articles are linked in the show notes for this podcast episode. But what we thought would be helpful maybe is to cover this topic and just go over some of the key points that we covered in the articles, at least at a high level. And then we would, again, encourage you all, if you're interested to learn more about this stuff, you can kind of read a little bit more depth on those different articles. But the topic is things that organizations, healthcare provider organizations, whether it's a hospital or a health system or a medical group, things that we have learned and observed since early in 2020 when the COVID-19 pandemic really kicked off. And specifically what we wanted to look at were some of the gaps that have been identified or the weaknesses perhaps that have emerged that organizations didn't really even realize they were there, or perhaps they knew they were there but didn't realize how serious they were or how risky they were until a crisis like this year, the one we've seen this year in 2020, kicked off. The point here is not to talk about COVID-19 and the impact on the healthcare system or whatever. I think there's been plenty of that discussion. It's not even talking about what organizations have had to do directly in response to COVID-19. What this is talks about, it's more in the realm of crisis management, or more specifically, hopefully reducing, possibly eliminating the severity of different weaknesses, different gaps and risks that exist in organizations that really just increase and expand the challenges that come with different crises. And the idea here is simply the more we can identify these things and hopefully address them to whatever extent we can and plan for them pre-crisis, pre-market volatility, then the idea is that hopefully they will be less of severity, or possibly even eliminate them altogether when that crisis strikes. So this is really talking about planning and specifically addressing weaknesses and gaps in organizations. And what I did was earlier this year, I reached out to various folks here throughout Coker and our various practice groups and service lines, and asked them for their observations working with clients, things that they've observed and things clients have asked them about that kind of go with this theme, different weaknesses that have emerged. And I got a lot of feedback. And so what I did was I broke it down. There's 3 parts to this, and I'm going to go through each one here, not in great detail, but I'm going to cover them from a high level. And again, as I said, you all can go and read more about each one. But there are 3 overarching categories that we looked at. One was financial planning and performance. The other was technology and compliance. And then we looked at operations and staff. Along with operations, we looked at things like staffing and performance improvement, patient access, et cetera. But most of the feedback that I received, the different points really fell into those 3 categories, which really cover the entire continuum, if you will, the business operations side of healthcare organizations. So let's start briefly with the financial topic. And this is probably the most obvious one, honestly. This was the one that probably had the greatest acuity, and it hit early on in this pandemic when things started to really shut down in March and April. And patient access was limited. Everything changed, obviously, for all types of businesses. But for healthcare organizations, what we realized there were a number of things that were particularly exposed when looking at how they could best adjust for this market volatility that came with this crisis and address them going forward. And so when we think about some of the financial risks that emerge, I think one of the things that we realized was the nature of a lot of healthcare organizations and how they run financially, particularly with medical practices. I think we can kind of break that down. But when it comes to medical practices, they're really used to operating at relatively low margins. And for some hospitals, that's the case too. Other hospitals, sometimes the margins are better, more attractive, whatever it may be. But generally speaking, there are a lot of cases where healthcare provider organizations, again, are really used to operating at relatively low margins. And in addition to that, they don't often reserve a lot of capital. And again, that's more on the practice side. When you look at a medical practice, you don't typically see a lot of what we call retained earnings or capital in the business that can be drawn on in the event of reduced revenue. And again, for hospitals, there are even a lot of hospitals that are used to operating at very low or no reserves, or even at a loss, depending on their status. And there's a lot, you can get in the weeds with this, which we don't have to dive into there. But definitely on the practice side, it's very common for there not to be a lot of cash left in the business. And the reason for that is simply that most practices, the majority of the earnings of that business, meaning what they earn over after paying expenses, goes to the partners, goes to the physician owners. And so you typically don't see what we call EBITDA or net income, basically earnings. And so when things really were put on hold and volumes declined when the pandemic kicked off, that was something that basically these practices were having to go to the doctors, and they were having to capitalize it with pay expenses with out of their pocket, basically with their own money, and their incomes dropped significantly. That was something that was felt very directly by, particularly when you think about practices, by the providers. They had to figure out how to reduce expenses in a very short time frame, which is extremely difficult to do, because sure, there are some things that businesses can go in and cut. But there are other things, for instance, real estate and leases, things like that, office expenses that are relatively fixed. You can't just go in and create savings from that or reduce those expenses. Even on the staffing side, which is typically going to be one of your biggest expense categories. Sure, you can reduce that, but that means probably reducing your workforce, meaning you're going to have to let people go, or at best, furlough them. And no one wants that. So that shook up a lot of groups in particular out there when COVID kicked off. And the good thing is that the significantly high levels of decline when it comes to the revenue didn't last. They weren't permanent. So as we got into other solutions, we figured out, okay, what are some protocols that we can put in place so doctors can get back to treating patients in person. In the meantime, there was a huge flood over to adoption of telehealth. So there were things that helped stop the leak there for a little bit, and then we've gradually seen them come back online where there's more in-person interactions, as well as the continuation of the telehealth or virtual-based interactions, which there's equitable reimbursement for those cases. So, which is something that I think a lot of both groups and hospitals also had to really learn quickly and adjust for in the midst of this crisis, which was there was extremely low adoption of telehealth pre-COVID. We're talking less than 20%. And even at that varied as far as what the telehealth actually looked like. I think in May, June timeframe, when they looked at it, that number had gone well over 50% in terms of adoption of telehealth. And most of that was based on virtual visits. It was very timely in that started 2020, the changes went in for reimbursement that allowed for the billing of telehealth services. So, or services that were delivered via virtual visit. And so that was huge. Obviously, the fact that you could bill for a virtual visit changed the game there. And again, it allowed for many groups out there to actually withstand having to shut their doors through this crisis. But the challenge there was many of them were not set up for that yet. So even those had already adopted some degree of telehealth, they had not necessarily updated their billing processes to bill for those services and ultimately receive reimbursement for them. So that was something that they had to just work quickly. And again, the majority of providers out there not having any telehealth pre-crisis, they had to figure out how to adopt it and then bill for it at the same time. So there were a lot of challenges there. And I think that's a good segue. I'm going to jump over to the second category that we had, and that was related to technology. And here, the theme is similar to what I just talked about, because not having some sort of telehealth strategy in place meant groups and hospitals were having to figure out in the midst of a crisis how they were going to adopt this. And then they had to figure out how to bill for it. But even those that were already on it, I think they realized there were still some challenges. So on top of dealing with the challenge of having to figure out what system would they use, how would that work, communicating with patients, how did it integrate with their existing technology and those things. Even those groups that already had telehealth, what we saw was other things emerged. One was bandwidth. Pre-COVID, groups and hospitals that were engaged in some degree of telehealth services, the volume was very low. Once in the midst of the pandemic, those numbers just shot up very quickly. So a lot of these users did not have the technological infrastructure in place to support that kind of volume. It also required the actual infrastructure itself, the software and solutions in place to be expanded, because maybe let's say a hospital system. This is one example. They were doing some telehealth, but it was only for a specific service. It was a subspecialty, but they had to then figure out how to expand that to other services, other specialties within their system, and they had to make sure their systems could support that from a bandwidth volume standpoint. So that was something. And then again, as I referenced earlier, they then had to figure out how to build code and bill for all those things. Another critical gap that was exposed from a technological capability standpoint was the security around it. And this was a major compliance thing that we worked through with many of our clients. But when you're adopting something like telehealth in the midst of a crisis, and you're doing it on the fly, you're doing it very quickly, you're fast tracking this, you're having to ramp up everything. It's real easy for things to slip through the cracks. And so a lot of health systems in particular had to figure out how to make sure whatever they were doing was secure, it was HIPAA compliant, there was coding compliance there to make sure these things were being billed for properly, and ultimately that the encounter was fully compliant and documented that it was as such. So cybersecurity has been a hot button topic in healthcare for a number of years, but this year really went into kind of a different level of acuity, in that there was so much happening in such a short period of time, and things like telehealth and virtual services became, as I referenced earlier, critical to in some cases, the survival of these entities. And so they couldn't sit on it. They couldn't take the normal amount of time. Frankly, they had to fast track all the other things like compliance and everything, security, everything that goes with that. We believe telehealth, for instance, is here to stay. It may not be, it won't remain at levels that we saw in early to mid 2020, but I don't think everybody's going to flood back into the traditional way of patient clinician encounter, just purely maybe out of convenience. But there's still a lot of concern, at least as we're still talking about, as COVID is still very much here, and a reality for businesses and individuals. We're seeing the ability of telehealth to be something that is definitely going to stick around and will remain also as a key tool for patient encounters. And this ties over a little bit too. Again, I'm going to segue over to the third category and talk about the operational side of this. And again, there's a lot of overlap in between all three of these, because on the operational side, it's similar to what we talked about on the technology side, is that where organizations were having to put in place very quickly different things, whether it was on the billing side, whether it's on the technology side, or in this case, on the operational side, they just weren't operating at a level of efficiency that allowed for effective adjustments and pivots when crisis hit. And one of the things that really jumped out to us on the operational side was staffing. And when you saw different organizations trying to implement work from home or remote-based services, remote-based support, again, on the fly, a number of things popped up. We talked about security. That was an issue. But even going back a step from that, what we saw early on was that there was a huge flood in purchases of laptops. And there was, for a time, a shortage of laptops available because a lot of these organizations never operated with laptops. And people working in groups and hospitals didn't work from home. And so that was a challenge. And then you could go back even a step from there and look at just the challenge that many of us all over in all kinds of industries have as far as working from home, because they had kids at home, or they had other family members that they had to help support and help with school and things like that. So the nature of how the dynamic of the workforce changed. And again, that's not exclusive to healthcare, but what we've learned and seen with a lot of our clients is specifically as it relates to their staff working with each other and providing the support they need. There were a lot of challenges, particularly early on, just being able to do the work. And then on top of that, you have to think about the security, the compliance elements, the sharing of data and information, and the concerns, potential risks that come with that. So that was something. And then the other piece, and we'll kind of bring this full circle here. Again, I'm covering this from a very high level, so I really encourage everyone to go out and read this further. And if there are specific questions, obviously don't hesitate to reach out to us. But the last thing was just the impact on patient access. And this is one of those things that it was unavoidable, I guess, to a certain extent, and especially early on. But we've got feedback from our clients that the impact on patient care as a result of this pandemic has been, and we're talking non-COVID patient needs here, but just regular routine needs, has been severely impacted. And that was something early on that groups in particular had to figure out, because they had to figure out how do they see their patients, particularly patients with chronic needs or specialized cases, where they have to bridge any sort of gap between communications, and really in many cases face-to-face encounters were required. They had to have a solution for that. So again, I think what this crisis has taught us that there needs to be a plan in place that if something happens to or something event occurs, or something happens to prevent those communications and those face-to-face in-person encounters, there has to be another solution, because you can't just put healthcare needs on hold. We know that that's not anything revolutionary, but in many cases we just did not have the plans in place and the processes in place to adjust for that when it was most needed. And then generally speaking of patient access, I think, again, telehealth has helped bridge that gap a lot, but patient access is a very ongoing routine challenge for particularly groups, whether you're hospital owned or they're independent or anything in between. Patient access is always a challenge. And sometimes it's a technological challenge. Sometimes it's a process oriented issue. Sometimes it's related to inadequate systems. And sometimes it's something unforeseen and that we can't control for, like a global pandemic. But there are many things that can be done to enhance patient access, just like there are many things that can be done to plan for continuation of that access when something unforeseen like this happens. Again, those were 3 categories that we covered. We could go on, we could spend hours diving deeper into each one and giving specific examples of what we've seen from organizations. We didn't want to do that necessarily in this series because it'd probably get a little too far in the weeds, but this is something that we'll continue to see. And again, this is not about looking back at COVID-19 and how it's affected the healthcare system in 2020. It's really about taking the lessons learned from these events that we're still working through today, very much so, and take those lessons and use them to plan for whatever happens in the future. And it may not be a global pandemic. It may be something else, something much smaller, but these lessons can be applied to and scaled to whatever needs that organizations may have. So again, I want to encourage you all, if there are specific questions that you have about planning, risk mitigation, planning, strategic planning around any of these areas or anything else that we didn't cover that we can plan for more effectively in the future to be prepared for these things and to adjust for them as needed when they arise. We would welcome your questions, welcome your feedback, and happy to have further dialogue one-on-one with any of our listeners on that. So that's definitely something that many of our clients have been reaching out to us on. We've been having many discussions with hospital boards and hospital executives and medical groups and the physician community on taking lessons, these and many other lessons that we've learned this year, and using them to plan better for the future. So we'd love to have that conversation with you if you're interested offline. Don't hesitate to reach out to us. But other than that, we will stop it there, and we look forward to continuing this discussion and covering many more like it in future episodes. Thank you very much for listening.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback. And we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.